Good evening, everybody. Welcome to another episode of Aware and Care, your weekly Ayurveda dosage show of well-being, mind, body, and soul. We always have a conversation with Dr. Ambika Nair, who's an expert in this subject. She's a co-founder and chief consultant at Santhigram group of companies. Today, we're going to talk to her about another interesting topic. But before we start that, I do want to quote something. They say, the wearer knows where the shoe pinches. And everybody wants to stand up on their feet right from the time they are born. They start crawling. And the first thing that every parent enjoys is when the child starts walking. And then we walk into life, into our own paths. I'm sure you started guessing where we are leading to. But before that, let's welcome Dr. Ambika Nair. Good evening, Dr. Nair. Welcome to the show. How are you?
Namaskaram. Thank you. Thank you so much.
Namaskaram, Doctor. I'm sure you must have guessed it by now where I'm heading because I've started walking, but looks like I'm not going to walk too far without your help. There's a very popular saying in Hindi saying "Dharti ka boj," basically too much of weight on the planet. We become a burden sometimes. But burden is not only about the weight, but it's how we balance our weight. Many of us, especially women, I'm sure you will be able to give more information. We all have this problem with our feet, our heels. I think the terminology is called plantar fasciitis, where the heel of the foot is hurting a lot. You're unable to stand, you're unable to sit. And then sometimes you have a radiating pain in the thigh. So you're not even sure where it is all starting. But somewhere we know there's some problem with the foot. So today, let's address this particular concern, a special request from one of our viewers, and we will help them with what remedies are available in Ayurveda. Let's start with basic definition of what this particular problem is.
Yeah, the very nice subject you have given me. Thank you so much. Okay, very interesting, I should say. Very common these days.
Common.
Okay. It is called a plantar fasciitis. It's an inflammation of a thick band of the tissue that runs across the bottom of your feet, actually.
Okay.
So mostly it will be on one side, because unilateral. Otherwise, sometimes, because it can even lead to both bilateral also.
Okay.
Okay. So it is even otherwise called, people call it as, like a calcaneus spur, flat foot. There are so many things. And, in Ayurveda, we call it as vata antaka. Okay, because actually vata is there and kapha related things also, because there will be, on examination, you can see there will be swelling over there and, the degeneration can be there. Normally, people will tell that when I get up in the morning, I cannot put my foot down.
Okay.
So after walking little bit, few steps or little bit walking, they feel better.
So this is very interesting. After you rest, sometimes the pain increases.
Yeah. Because kapha, toxin is inside. So this toxin can be, like a swelling, I told you, like many, like even a trauma, or if you're standing, some degenerative fibrous tissue can be there. Some, some proliferation. Sometimes it is without or with also. Okay. Yeah. Okay, so like a proliferative pain also is there, that because the pain can be distributed to the even on the thigh also, on the back also they will complain of. Some people, in my experience, I have seen that they have a lot of backache actually.
Oh, okay.
Okay, so yeah, we take care like that only. And some people will complain only of heel pain.
Heel pain. So at what point in life does this problem actually creep in? Is it irrespective of age, or is it?
No, it is actually, you can see that in the age group of 40 to 60, but nowadays it is visible in the youngsters also.
Okay.
Because long standing, like causes can be, like in the younger generation, younger population also, you can see the aerobic, like exercise dances, ball dances, ballet dances are there, so, like runners. And they, like overdoing the things. Actually, even in yoga, certain yoga people overdoing the things. I have seen that they have this problem because patients comes to me like that.
So, doctor, you're saying this is a problem with the tissue or with the bone? You mentioned
both.
Tissue.
Both.
Oh, okay.
Yeah, both. That's where the pain will be there. Okay, tissue that will be there, swelling will be there. Okay, and even if your weight is also too much, where the like obesity, and ladies, that you wearing your high heel shoes. Standing in the, like you can see that our people who stands and work, like school teachers, that standing and working in the Walmart, Costco, all these places, because they are not allowed to sit. So those people also suffer like this, because if you're standing for a long time, walking for a long time, so this can happen.
Very interesting, because there were so many misconceptions and myths about this particular problem. And today, I think many people across the globe mention about this. We start off by saying that my leg is hurting, my foot is hurting. And by the time we realize which part of the entire organ is hurting, you come to realize that it has come to a place where it needs complete extreme help. There are many times I notice that people who have this particular heel pain, they tend to stand on their toes and put all the weight on the toes, because they don't want to put the heel back onto the flat on the ground. Does that also aggravate the situation?
Definitely it will aggravate.
Okay.
Because so many people actually, they go and take the steroid injections.
Yes, that was my next.
Because they come to me actually, because they even after surgery. So many cases comes to like that, like after the surgeries, surgery was done, now, like now 3 months, now still I cannot put the foot down. There comes the Ayurveda, because actually Ayurveda has better care for these things.
We'll get to the treatment one after the other, doctor. Of course, you're always kind and supportive in giving all the information that is required. I'm sure that many people out there are thinking that, oh, I have the pain not exactly on the heel, but around the heel. Sometimes it's on the arch. Sometimes it's only on the right toe or the left toe. So I guess all these are cumulative symptoms of this particular pain. Now, also please add a little information about people with cracked feet. They have a lot of cracked skin there. They tend to peel that. Do these people also, does that support?
No. That is a different entity actually.
But does
that
it
is high vata actually. High vata, cracked feet, like skin dryness, dry eyes. These all come in one group actually.
But that does not contribute towards
nothing. Of course, cracked heel people will have pain while walking because it will be bleeding.
Okay.
But that is not this case actually.
Okay, that's very good to take it out from the main concern of the
yes
in the heel. Plantar fasciitis, that's what the subject today is we're talking about.
Plantar fasciitis.
Are these the only reasons why this pain comes, or is it something also to do with the body structure? Sometimes people have
improper walking. If you are walking on a like improper place, like a zigzag. Okay, that uneven space, if you have to walk. You can see that is in police offices also. So many in police group actually, because they run around. They don't know what they are doing. And running, long standing. Because so many times it is like a police. Even from this country, so many people came to me from the police department also. Because of this,
You're mentioning, doctor, I do understand that most of the people are always standing, bent on one side, putting the weight. Switching the weight. Okay, that's where it all comes from.
That may be the reason actually, because actually, see, like here also workouts are done. Workout also not like some people work out for 3 hours, 4 hours. So those people also they can get all those things if they are not taking in the proper way of doing the things.
Okay, are there any specific body type of people who are more prone to this apart from physical conditions or working conditions?
Physical conditions, kapha related, and like vata related.
Okay, we tend to see that. And does it also pass in the family? Like, my mother had it, my grandmother had it, or my grandfather had it. So when I'm getting
it's not a must. It's not a must. But if they are having, like they are flat foot, it can happen.
Oh, okay.
Okay, that you can see some people with a big gut, long, like excessive pronation of the foot actually, that is pes planus, and like even that, like a pes cavus, like a high arched.
Okay.
You can see like a bend, so these people are also, like very common to get all those things actually. The structure, actually, the bone structure also, because actually, certain people, they don't stand in proper way. Yeah, that also, and sitting positions.
Okay, now let's come to the phase where we know that we have this particular problem, but we are not approaching the doctor immediately. We are doing lots of other things like soaking our feet in hot water, going to spas and getting massages, putting some oils and other things. What is the worst situation that can happen with this problem if it's not addressed?
the pain will be so cruciating. They won't be able to get up from the bed at all.
It's a very depressive pain.
Very, very strong pain, actually. It is like, they won't be able to lie down. Because normally people take like anti-inflammatory things
Exactly.
and a lot of cortisone they will be taking. Then they come. Yeah. That is the thing. They won't be able to stand or walk.
You did mention about the steroid injections. I think that's a very common form of treatment. And once again, friends, in this program, we do not interfere with what your current treatment is. But when you come to an Ayurvedic approach, the treatment is completely different and it is very holistic and herbal in its thing. So like Dr. Ambika Nair always insists that please reach out to your immediate doctor first, have a talk. And at any point, you need to take her advice and opinion. Their team is always available to talk about this. So what kind of tests are available to know that there is some problem with the heel?
Whether it is actually calcium deposits, some people will get the calcaneus spur, so that the growth of the bone. So such they can go for the X-rays are there, MRIs. Actually, MRIs they don't actually. That will help to see whether any degenerative changes are there, like arthritis changes. Okay, so such things it will help a lot.
Okay. Now, this terminology is specifically used only for the heel bone and not for anything else. But when you say a growth spur, it could happen to any part of the body, right?
That is there, but mostly we have seen that actually it can be, the spur can be there even in the occipital area also. But like in the heel, it is so very common in calcium deposits are there.
Okay.
So that will go away actually.
So, friends, I know you are very anxious to know what are the home remedies. We are talking all about symptoms, but friends, it is always very important to understand the symptoms also, because we get so many messages from our viewers that when we have this very casual form of conversation, we are touching base on certain unknown factors. Oh, it's just one day because I was walking, I was standing in Disney for 2 hours. That's the reason my feet are paining. But you never know where it leads to later point, because these small symptoms are very important to recognize as we move forward. Now, doctor, the pressure is always on the backbone, on the spinal cord, or any other part of the body affects most?
Spinal cord only.
Spinal cord only.
Yes.
So you just mentioned that there are X-rays done that can also help to understand what this is.
People come with all those things only to me.
Okay. Okay. Now we have lot of children, lot of people, adults, everybody into sports and activities. So it's very good to be, mentally and physically fit, and we want to keep ourselves very, healthy. But do we see that you did mention that sportsmen and sportswomen also get this problem a lot? What kind of shoes are recommended? Because we heard about steroids, we heard about massages. We also sometimes hear about, you put something in your shoe to keep your balance right.
I know. But that is all those people, some people will have a little bit of, like I told you, spar and all, and even flat foot, they use that. So extra soles are used actually. There are very good sports shoes, that because whoever their sports people will be telling them to use that, because I won't be able to tell that actually what shoes they should use. But when they come to me, I will tell them what they should use actually.
Now somebody is at the doorstep of Santhigram, waiting to meet Dr. Ambika Nair with this particular problem of plantar fasciitis. So what are the steps involved? And steps, when I say pun intended, what steps do they take to come inside and explain their problem, and how do you diagnose this?
Okay, when they come, we see that first of all, the history is more important. Okay, but of course, I do the pulse analysis and we know that where the problems is, but still we listen to their history and we have to observe the patient, whether any swelling is there, whether any other degenerative changes are there, whether they are really in deep trouble, not to put the foot down even.
Okay.
So then we take them for the Panchakarma treatments actually.
Okay.
So oleation, oil, like Abhyangam is always very good for them, which will improve the circulation. Then special layapams will be done. With the special, Kolapurutadi, Jadamayadi and all, we make a special like a paste and we will apply over there and we tie that area. So that swelling also goes away. And very good medications are also there. Herbal supplements are there. And we have to do dhara also. There are so many type of treatments actually. According to the need, we will give. Because whether it is
you did mention twice about swelling. I just want to touch base that as you continue with your treatment options available there. So when you say swelling, where exactly do you see most often the swelling? On the ankle, on the calf, on the toes?
No. Sometimes there will be tenderness on the calf muscles also because of the inflammation. Otherwise, like on the joint only it will be there.
Is it
on the foot area?
Is it also possible that your heel is not paining so much, but your calf muscles are paining because of a reflective?
No. That will be because that maybe some problems are also there. Whether any like urinary infection. See, related things has to be ruled out also.
Okay.
Not only that, because sometimes the patient may be having like a low backache, maybe it is a sciatica also.
Okay.
So it can be a double thing. You understand? Not only this, like a plantar fasciitis, that can be with other diseases also. So we rule out everything and we come to the proper care of the like a person by giving the proper treatment actually.
So you were just talking about Panchakarma and other active treatment procedures. Please continue with that.
Yeah, we will be giving dhara, that kashaya dharas are there, taila dharas are there, which will relieve the pain and the inflammation. So they will be able to put the foot down after a few days. Okay. And vastis are given to the patients. Yoga vasti, kashaya vasti, niruha vasti. So this all the detoxification will be done actually. Then, like the local, I told you that we put the paste and we tie over there and tell them to release it after 2 hours or 3 hours like that. Okay. So this all helps them a lot actually.
So does this treatment require complete bed rest or no movement for a couple of hours, or people can continue with their activities?
No, because actually it all depends upon the patient's like severity of the case. If they cannot stand, then we tell them to elevate the foot and lie down as much as they can, at least for 2-3 days, if in a very bad condition. Otherwise, we tell the people used to come and they go to work after the therapies.
Oh, that's wonderful. Okay.
Yeah, so it's not like that. Okay, so they will always go. Okay.
And doctor, in the last couple of shows, when we always mention about Panchakarma, and of course we talk about how it is done. Many times people are asking the question that this Panchakarma treatment, is it done on daily basis, or do we have to come once or twice? I think in what I would have suggested would be like depends on case to case, but you're the better person here to give more information.
No, Panchakarma should be done on a daily basis. Okay, maybe like some people need 1 week, some people 2 weeks, some people 3 weeks, even some people more than that. Okay, it all depends upon the case, what you're suffering, the disease, what you're suffering, and your mental and physical ability.
Okay. I want to become fit and fine, but I want everything fast forward and jhatpat from all my medicines or treatments.
Yeah, then you need 3 weeks.
You need 3 weeks. No, but another popular question which has been coming up is these treatments at the center. What is the average time? Like, for example, even if we take dhara or for Panchakarma, is it a 1 hour session? Is it 45 minutes?
Panchakarma will be like it has only Panchakarma means it will be like a 1 hour session. But what Panchakarma you need, that is also more important.
Okay.
So, okay, whether you need a sneha, ghrutam, them to drink, that will take only half an hour. Only Nasya treatment means only half an hour. Then, like other treatments, it all depends upon. So, we give like a package, Madhavi.
A package, yeah. And I'm sure you're waiting to tell people that, if you come here for a treatment, you should take out some time to see that you focus completely on your treatment and not rush out or rush the procedure.
All these years, we accumulate everything day by day. We don't have any time to do anything for us. But we will have so much of time, like we will plan for everything. Outing, our vacations, going to India or any other our native places. Okay, family parties, birthday parties, even shopping, everything we plan. But you have no plan to take care of your health.
Your wellness plan is not there.
Okay, that wellness plan. So make a diary, write down what you are doing for yourself actually. So that, that the aging factor can come down, especially when you reach like 35 to in between 35 to 40, think of taking care of yourself actually. So that all these issues will be taken care, like your skin will remain healthy, your bone will become healthy, your mind and soul, your thought process, everything, because mostly people die of the complications of the diseases. So if you come through the Ayurveda, you can see that how nicely without complications you are able to live a very, very long life. Even till 120 years, you can have a very, very, very healthy life actually.
Independent life, strong and healthy independent life. So, doctor, we are talking today about plantar fasciitis, and what kind of vitamin deficiency usually is noticed in these problems? Is
calcium and calcium deficiency, but if the calcium deposits are there, it's not. That's what I told you. If plantar fasciitis, actually, normally vitamin D, absorption of calcium will not be there. And some inflammations also, because actually if you are traumatic, also if you had a fall, something like that, sometimes it happens with the fracture also. See in such cases like that, okay. Then, doing proper exercise, caring a lot. If you really do little bit of abhyangam, it helps a lot. If you, like home remedies, I can say that if you don't have anything, buy some castor oil, take 1 tablespoon every day at night. That will relieve a lot.
That is like the Maha Mantra of all remedies.
Okay, yes.
The people who are watching are already going like this with their nose and the eyes. But well, once
they will like it, because so many people will tell me, even while coming the clinic, you love turmeric and castor oil. I told you, yes, that is the root cause. Root of everything. Turmeric is also very good, that you can take empty stomach in the morning. So that will help a lot. And treating for the root cause is more important actually, because see, you try everything, then only you go to the doctor. The doctor also tries everything, then only they come to Ayurveda. When everybody wash up their hands, only think of like Santhigram. Okay, then we do take care. That is very. I'm very confident that we are taking care.
Absolutely beautiful. So friends, what you just heard is basically you have done what you could think about doing for your body, whether taking care of it or not taking care of it. And when it comes to taking care of it, you have tried everything that you could. And when you reach the doorstep of Santhigram, or any doctor for that matter, and Dr. Ambika Nair has been very nice and kind on always mentioning, whichever doctor you are going to, give them some time to undo the problem, or give yourself some time and trust the process. And then you can think about any other remedy that's possible. So when you're at the doorstep, trust the treatment and give some time to yourself. Doctor, what kind of foods are recommended to avoid this problem or to take care of this problem?
Vata has to be controlled actually. Kapha also has to be controlled. So the digestion should be better. So use cooked food, more important, and warm food. Nothing cold. Cold will aggravate the pain. Okay. Then, standing, especially ladies will come to me telling, we can't stand and do the cooking. That is a big issue. So, after the few days of treatment, they will tell that I was able to stand for 1 hour, 45 minutes. Then they say that slowly we started increasing it. So that all they can see visibly, they can see how much they are becoming better. Okay, so try to avoid as much as, if you are having an issue, don't go and stand, for a long time.
Absolutely. Doctor, you have always mentioned about cooked food, and many times after watching the episode, many of our viewers always have some discussion as to what is it that Dr. Ambika Nair mentions about cooked food. We all cook our food and eat, but I think what I understood from all my conversations with you is sometimes we look at instant foods that are just warmed and reheated and eaten. That is maybe not considered
freshly cooked food is more advisable. Yeah. And because actually cooking and keeping but here it's not practical. At least warm the food and have it actually.
Yes,
that's because because you see uncooked food means, because when the vata is aggravated, the pain will be aggravated. So chickpeas has to be avoided, rajma has to be avoided. These things anything with the flour. White flour, what we use, that should not be used actually, because these all aggravates vata. That's why we tell, use cooked food only. And fruits are, because people will make fun of me by telling, oh, what about fruits? Fruits you can have. But when you make smoothies, you can add little bit, whatever you are using, warm the liquid. If it is like a juice, also keep it outside for some time so that it will not be very cold. Okay, otherwise you can use little warm water, because that will help. Your problem has to be solved. That is one of the main reasons.
Absolutely.
Yeah.
So, Dr. Nair, now the pain is there. What are some of the Ayurvedic or herbal remedies to reduce the pain initially when the first phase? Most of us are using painkillers, but are there any other?
We don't give any painkiller like that. Actually, we have like Bella Thailam is there, Maharaja Prasaranyati, Gulgulu Tiktakam. There are so many things actually. So to reduce the inflammation, once then even Sudarshan is used, Amrutotram is used. So when the inflammation comes down, turmeric like a curcumin. Okay, so when that inflammation comes down, we reduce it actually. We see that because sometimes, because this plantar fasciitis, it will be little related with more related with the stomach also.
Oh, okay.
So that's why the toxins, so when we detoxify, they are fine within no time.
Wow, castor oil definitely is a remedy. So, doctor, what is the things which can give some comfort? Like, is it hot compress, cold compress?
Hot compress is good actually. It is like sometimes that area will be very much swollen, so cold compress is important. Okay, because that area will be very tender, so you won't be able to put any heat over there. Okay. So cold compress is also according to situation, Madhavi. Okay. So that has to be taken care of.
Where do you recommend for people who have this particular concerns? Do they have to go to a specialist, or once these small remedies and other daily changes are made?
They should come, they should take care of themselves because they know their condition. They know their body well because they are carrying their body for since long years. So if they know that something is going wrong, they should go to the doctor. That is more important. Actually, rather than getting into much, bigger complications.
Okay. Dr. Nair, we've, I think, mostly covered most of it. Now, one very confusing question that is popping up in my mind is when my foot is hurting so much, what kind of exercises are recommended? Are exercises good to reduce the pain, or it will aggravate the pain?
Trikonasana is good actually, but you have to do the sit and do it. Don't stress, don't stand and do all these exercises, but it will pain. Pain will aggravate actually.
Few weeks we have to.
I will tell them not to do the exercises a lot. Actually, you can do the breathing exercises.
Oh, okay. Calming down.
Yeah, calming down. Otherwise, it will be very difficult.
Okay. So I think most of it we've covered. But if there's anything that you want to add on into this program, today's episode of Plantar Fasciitis,
they can massage their feet with oils and all. There are so many oils available. Okay. Even after the treatment, we tell them how to take care of themselves because every day we cannot call them for the therapy. So once they are better, we see that how they will take care. So we give them also oils, what they can do at home. We teach them also how to do it. And even how to take care of them, even with the diet, how to, how to rest, how many hours to rest, everything we tell them actually.
Awesome. So now that vaccinations have started and people are taking their vaccinations, what is the schedules for having appointments at Santhigram? Can you please just touch base on that lightly?
Yeah, if you don't have a COVID, you are welcome to see me in person. Otherwise, only virtuals are there, and we are doing the Panchakarmas. But you have to be with the certificate that you don't have the COVID because in our center we are all vaccinated, and so we are even both vaccines are taken, so we don't have any issues in taking up your cases. So you are welcome anytime.
Yet prevention is the best cure, as always.
Absolutely, absolutely.
And thank you so much, Dr. Ambika Nair, for today's episode on this problem called plantar fasciitis. And with all the remedies and suggestions and inputs that you've given, I'm sure many of our viewers are already feeling very hopeful. And if there's still a problem, you know where to reach Dr. Ambika Nair. Thank you so much for today's episode. I look forward to meeting you soon on our next episode on Aware and Care.
Thank you so much. Because if your foot is there only, you will be able to walk and do everything, running around. Okay, so take care of your foot. And it is already snowing, so you will be able to, move your snow also nicely if your foot is good. Thank you so much.
Thank you.